Okay, so there's a few functions we have here once we've taken our dermoscopic picture. First one is we can use these tools to help us evaluate lesions. So there's asymmetry, border, color, and the diameter. So it doesn't really give you the exact measurement, but it helps you get a rough guide. And we know that because of this photo on the dermatoscope, one of these little areas here is 1 millimeter. So this is probably like 1.5 to 2 millimeters in size. There is also an AI powered kind of database here, which is not that good, but it's there. It's not to be used for anything. It's not a diagnostic tool. The second thing we can do is, which is useful, is comparing images. So if you have two pictures at different times, it will overlay them and then toggle back and forth so that you can see if there's a change or not. There's an option to do some color matching. So if the two photos are like different exposures or color brightnesses, then it will try to attempt to match them a little bit more as well, so you can compare them. Over here, there's a few different things that we don't really use all that often, but I do like to use the pathology diagnosis if we are sure that if we biopsy something or we have cut something out and we have a diagnosis, especially for things that are skin cancers and melanomas. But there's a bunch of different things listed here, but you can just type in free text as well. So I can just write nevus. You have to click benign melanoma, non-melanoma skin cancer or inflammatory. Don't need to click anything with treatment recommendation if you don't want to, but you do have to write something in the notes. So we can say biopsied and then click submit. And then the good thing about that is that it creates this little DX down here, which helps us to notice next time when we come back to look for this spot again, that it is no longer there, or something has been done with it, or at least we know what it is. For other things, I will often just make a note. For example, I'll make a spot note like cryo done, or something like review again in 2 months. And then I will make a note of that in the notes in best practice as well, that we need to check spot 4 in 2 months, and I will put a recall in the notes so that the patient gets a text message to come back and have that spot seen to again.